So today we are going to start a series of lectures on nephrology, and that's about nephrotic syndrome. Anyone with a basic skill about nephrotic syndrome? Yes? Okay, signs and symptoms? Okay. Let me give you the basic concept about it. Basically, when we tend to define nephrotic syndrome, say is a clinical pathological condition or a group of signs and symptoms. Okay? Nephrotic syndrome, a syndrome is just a group of signs and symptoms. Okay? So let's begin. Nephrotic syndrome is a clinical pathological condition or is a condition characterized by, what are the characteristics then? Lipiduria, yes. Proteinuria. Okay. So, nephrotic syndrome comes from the word nephron. And nephron means either a kidney nephron, okay? So, here we are going to deal about the conditions that are affecting the kidney, but specifically the nephron. And you know nephron is what? What is the purpose of the nephron? Filtration of urine, okay? Okay. So, we are saying that nephrotic syndrome is a condition characterized by proteinuria, 2, lipiduria, good. Lipiduria, 3, odema, good. So if a patient passes urine and we do investigation, we find that proteins are present in that urine, what do we do? Should we say the patient has nephrotic syndrome? No. Why? We must have massive proteinuria, not any proteinuria. Must be massive, okay? Okay? Must be massive. Which massive? Must be more than, yes, 3.5 grams per day. Must be greater than 3.5 grams per day, okay? So if they ask you that what is nephrotic syndrome? Nephrotic syndrome is a clinical pathological condition characterized by proteinuria, lipiduria, and odema, okay? Any question up to this? Any question up to this? Okay. So, we have said that nephrotic syndrome, you can say the group of signs and symptoms affecting the kidney characterized by lipiduria, proteinuria. What's the meaning of that proteinuria? Passing proteins in urine, okay? Lipiduria, lipids in urine, okay? Then odema, when fluids are filled out, the interstitium, okay? Fluids, accumulation of fluids within the tissues can be either generalized or localized, okay? Can be generalized or localized, okay? And it can be both pitting or non-pitting of them, okay? So I'll give you the basic concept about this later. Now, we are talking about urea, okay? There is a common word called urea. What does it mean? We are passing either proteins in urine or lipids in urine, okay? Yeah. So, we have finished the definition. In your definition, make sure that these three are the marking points, okay? Key points we must talk about. Proteinuria, lipiduria, and odema. So what is causing this basically? As we shall be looking at the causes of this. So let's first look at the signs and symptoms of nephrotic syndrome. Signs and symptoms of nephrotic syndrome. One is odema, okay? Odema, good. One is odema. Which type of odema specifically? Any type, okay? Can be either pitting or non-pitting, depending on the pathophysiology of the condition that is present, okay? You know I'm going to give you the difference between pitting and non-pitting odema, okay? Hold on later, as we shall be discussing this in detail. Okay. Now, another sign and symptom of nephrotic syndrome, proteins in urine, okay, or proteinuria. 3, lower abdominal pain, good. Lower abdominal pain, yes, good. Another one can have back pain. All these are signs and symptoms of nephrotic syndrome. So how can we diagnose the patient? This patient has the nephrotic syndrome. Can we just say this patient has the nephrotic syndrome after this? Odema, proteinuria. Which proteinuria specifically? Yes? More than 3.5 grams per day. If a patient is passing less than 3.5 grams per day, should we say nephrotic? No. Okay? We shall call that patient either subnephrotic range, proteinuria, but not nephrotic syndrome. Okay? With nephrotic syndrome, we want to see the patient with 3.5 grams per day more. Okay? In urine. So suppose this is the investigation done by the doctor in the laboratory. We shall have 3 plus. Okay? 3 plus. So that is what we call massive proteinuria. This is called massive proteinuria. You can also call it massive proteinuria. So this means too much proteins are passed in urine, okay? Massive, okay? But if you find a patient just having like a plus, should we say this patient has nephrotic syndrome? No. Why? We need to see this massive proteinuria. As we shall be looking at the causes of nephrotic syndrome. You know, we don't have the actual cause of nephrotic syndrome, but we have the factors or contributing factors. We also have secondary causes, as you know, okay? But we don't have the actual cause of nephrotic syndrome. But we shall look at them later. Now, as we have finished the signs and symptoms, what else? We shall have lipids in urine, yes, and also the sign and symptom. Lipids in urine. You know, these lipids, when you pass them in urine, if you hold them in a test tube, you may find them on top, okay? You know, for them they are less dense. They normally tend to come on top, okay? Any question after this? Okay. Now, let's look at the causes of nephrotic syndrome. I know you are going to search for them later, the other signs and symptoms, because we shall also have what we call headache. Those are the things to come later. Dysuria, okay? Okay, so let's look at the causes of nephrotic syndrome. One of the causes, we have what we call diabetic kidney disease. You know, as I told you that we don't have the actual cause of nephrotic syndrome, but we have a belief that this can predispose someone to this, or this one is a secondary cause. We may have the primary cause, but not actual, okay? But basically, let's look at this. We have what we call diabetic kidney disease. So when someone has what we call diabetes mellitus, someone has what we call polyuria, okay? What is polyuria, first of all? Excessive passing of urine more than 2.5 to 3.5 liters and above. That's polyuria. So you know very well that the kidney is responsible for regulating blood pressure. How? It has to excrete water, depending, so that it can maintain, okay, the amount of blood, the volume of blood in the body. So if there is excess blood, the kidney has to overwork. You know, this patient, diabetic patient, they tend to take a lot of water in a day. Find a patient is taking like 2 liters of water or 3 liters of water. So there will be a hard task for the kidney to excrete some of this water. Okay? And you know, it is pathological. You know, it is, you find a diabetic patient is taking water, but because there is a lot of fasting. Okay? There is a lot of fasting, so the patient is taking, you may find the patient taking a lot of water, and at the same time it's going to pass a lot of urine. So it is a bit, you know, we can call it physiological, pathological, okay? Okay, so one of the causes of diabetic kidney disease, you know, when you overwork the kidney, its importance is to excrete, to maintain the blood volume, blood pressure, like that. So when you overwork it, you may find there is inflammation there within the glomerulus. Okay? So before I got about this, you know what we call glomerulonephritis? Inflammation of the glomerulus. You know the glomerulus has the filtration what? Filtration networks and the directs of endothelial linings within the capillaries, as I'm going to explain about the pathophysiology, okay? So let's first look at this. 2, we have what we call minimal change disease, okay? Minimal change disease. This is the direct effect on the kidney nephron. basically we shall have, you know what we call the filtration membranes, the legs of the glomerular basement membrane and the podocytes, that one. Okay? So the glomerular basement membrane, you may find